That's right.
Bethany, do you want to start?
Sure. I'm Bethany Wigan.
Rosie Trevino.
I'm Grace Thornton.
I'm Chase Williams.
And we're Group 6. Okay.
All right. So topic 1, which is smoking. I guess there's 3 different roles. So pre-contemplation, contemplation, and then preparation.
Mm-hmm.
And I guess it's just what our response would be in each role, right?
Yes. So does anyone have, like, I can take the first one, student A, the pre-contemplation phase.
And then I can do B.
I'll do C.
And I'll do
You can be our moderator, yeah. Sorry. Oh, ignore that. Okay, moderator, what do you have for me?
So we're just discussing what each student would say, right? I mean,
Right.
Okay, so student A is in the pre-contemplation stage, so this person's walking in super excited about their smoking cessation program and starting in the pre-contemplation. Okay, so student A, like, how would you respond if you weren't really ready to be in the action phase?
I think I would be somewhat resistant, not motivated, probably low self-efficacy, probably not really acknowledging the potential benefits. Maybe just focusing on, like, focusing like on barriers and things. So it might take just some talking to, or I don't know, other outside resources to get me to that next stage of contemplation.
So your response is no way.
No way.
I could never quit.
I'll never stop.
Yeah.
And and I think, like, one thing that could help maybe get me to the next stage of change would maybe be talking to these other people who are in those next stages. So talking to the person who's, like, in the contemplation stage, then the person who's in, like, the preparation, and maybe see, like, what got you to that point and why, and maybe just learn from, like, someone else's experience.
Yeah, I think the most important thing about that stage is just acknowledging the problem.
Yeah, true.
And oftentimes, if I find, like, so if I have a patient who, oftentimes, for whatever reason, I have a lot of active duty patients that show up, and honestly, they'll tell me, I have no idea why I'm even here, or they'll say, just because my doctor sent me, that kind of thing. And so oftentimes, obviously, they're at that pre-contemplation stage there, and so oftentimes I just try to find out, like, something that they're interested in as far as nutrition, or just some way to kind of get my foot in the door, and that way, it'll kind of give them a little bit of buy-in and kind of just get them opened up a little bit.
I would also ask them, like, what do you know about the harmful effects of smoking, or what have you heard?
Mm-hmm.
Yes, maybe they don't know, I don't know.
And the cost, it's not cheap.
Okay, so great. That kind of covers the brainstorming part too, right? Like, we're just brainstorming as we go through. Okay. So person B, contemplation, maybe a little bit more ready. How would you respond if I said, "Okay, I'm here to help you quit smoking. Let's do it."
And you're like, okay, I'm not really sure, but I'm thinking about it. I don't really have a plan. I think they want to, but they haven't really thought about a plan as far as how to execute it, so they're kind of just lost as far as how to move forward. So they're basically just reading a plan, helping someone create something for them, or just motivate them, encourage them more.
Maybe talk about, like, small steps.
Small steps, yes.
Yeah, I wrote down to discuss their perceived barriers, how they currently see the behavior change and the challenges, and discover what will move them out of the chronic contemplation to preparation.
Mm-hmm. Agree.
Yes.
Yeah, because you're kind of in the I want to, but something's holding you back from actually doing it, right? So what barriers?
Mm-hmm.
Yeah, and I feel like I meet so many people that stay in that stage. So the chronic contemplation really was a really good way to explain that in my mind, because so many people want to change or they think about it, but getting out of that stage seems really difficult.
I think the peers play a large role in that too. Who these folks hang out with, how their families, how they interact with their families and whatnot.
True. If they have like social support, or even if because I feel like smoking can be kind of such a social thing. So if a lot of their friends or family or like social circles smoke, then they might be thinking about it, but don't really have the support, and I don't know, that whole factor too.
Yeah. Okay, great. Okay, so session or person C, preparation. I'm here to help you quit smoking. Let's do it.
I feel like these are always like the easiest ones, right? So obviously they've had this life-changing experience, and so for instance, it might be like, I don't want to die from lung cancer like my dad, so I'm going to set up an appointment to talk to my doctor, or maybe even just sit down and start to Google, facts about lung cancer, or facts about smoking and that. So I think kind of going into what can I do in order to stop smoking? What are my options?
Mm-hmm. Yeah, I feel like these types of like patients or clients usually are very motivated because they, especially something like that's kind of a good jumping off point, and they're kind of in that phase where they like know they want to make a change. It's just taking the first steps and continuing towards that goal. That's the best kind of person to be trying to help.
Yeah.
Not good that they maybe have that background of like a terrible death, but
I think in this stage too, you just want to assist them with a concrete plan to move forward, because they really want to. They know the risk and what can happen with smoking, so that's done. But now it's just getting their plan. So kind of, I guess the difference from contemplation and preparation is contemplation, you're motivating them to think about a plan, and then the preparation, okay, let's set it and put it into play.
Mm-hmm.
Yeah, I wrote they are most likely to have a positive response. They're ready to make the change, and probably most in need of the structure of the program. And I said I would discuss the program specifics, ask what they've tried in the past, and maybe why it didn't work, and then give them multiple choices. I thought that I think it was in the lectures, when they're more likely to succeed when you have options A, B, and C, or like it increases up until 3 choices, and then they don't see a.
Right.
I thought that was interesting. Okay. Are we good with topic 1?
I'm good.
Okay.
Yeah.
All right, topic 2, self-management of blood glucose. It's an important tool for people to have diabetes to monitor blood glucose. It's underperformed. So this is a new technique. I honestly don't know a lot about it, but I obviously it's something maybe to change, like what current diabetics do, right? So how can we address, or how can we change this behavior? I wrote to address barriers in the population, discover the stage of change of the participant or the patient, and increase self-efficacy through training or motivational interviewing, or just understanding their barriers. Mm-hmm. What did you guys think?
I have a friend who's diabetic, and I was with her last week, and she lives in a different state, so I don't see her very often. But she was telling me that she went to this new endocrinologist, and he had this like new little device thing. I can't remember what it's called, but it like goes in her arm and it can sense her blood sugar, so she doesn't have to like prick herself all the time. So she said that that was like a big deal because before that she had been doing like the finger pricks and stuff, and so she said that just making kind of a small change like that really helps with her like self-management. So I think there's a component of like being up to date on the technology for blood glucose monitoring because it's changing so much. And like I've seen kids that have like their monitor and it sends it to the app on the phone and it does all these graphs and like really cool stuff. So I think it's like on our end, if we're like the counselor part, like being up to date so you can give them all the tools and then they can maybe decide like would this one be helpful and kind of tailor it, because the older population of diabetics might prefer the finger sticks and their glucometer, like they're good with that. So I think it's definitely tailoring it person to person. It's just being as up to date with the technology available and then fitting it to that individual.
I think too, just assessing where they're at as far as their knowledge of why it's important to, check their blood glucose, what happens when it goes high, when it goes low, and the long-term effects that can have. So educating them on that. And then if they're in the contemplation stage, you can always, mention that tool to them and then let them think about it or look at other tools that are available, because I know there's a bunch. And then that way when they get to the preparation stage, you can tell them, okay, well, this is how you're going to use it, how it'll measure your blood glucose. And once they're in the action, just following up that everything's going well.
Yeah, I had a lot of the similar thoughts. I think one of the first things I kind of wrote down was like the education and explaining and showing the negative consequences. And then, identifying basically kind of exploring the reason why these folks aren't self-monitoring, and then trying to lay, maybe it's something where they're forgetting, so maybe laying their monitor out like on the couch next to where they, come and sit down and watch TV for the evening or whatever. I was even thinking that, if there was a way to streamline it as far as from the medical side, where they automatically have renewals of like their testing strips. I can't tell you the number of times I've had folks that, say that they just ran out of their testing strips and they just haven't made it back to get it, So maybe if they had the automatic renewals, or they maybe got it in the mail or something like that, that might kind of help improve compliance in some aspects for some.
True.
So you want to move on to the brainstorming techniques? I wrote a little something like for each of the 10, but not sure if you guys saw like a couple of the processes more important than another. In the consciousness raising, like you guys are saying, discuss the consequences, pros and cons. I thought dramatic relief was really interesting in this aspect, or like personal testimony of someone that had changed to it with good results. I thought that would be really impactful in this scenario.
What about also too, like providing support groups for them to attend where they can...
That's exactly what I was thinking too.
That would be helping relationships, right?
Yes.
What else?
Would it be helpful to involve like a family member as well that can, attend the sessions with them, learn how they can help them and motivate them to be more just supportive?
Yeah, I think self-reevaluation is interesting too, and like ask them how would your life look with this,
Yeah.
Really understood it a little more.
And even like self-monitoring, maybe keeping just or having just like little goals every week. Like if they can acknowledge themselves maybe like not checking their blood sugar as much like one week, maybe just setting a goal for the next week to try to be a little bit better and Like it's okay to kind of relapse and do the backsliding, but to always be striving towards improvement.
Yeah, and I think they always like to hear, you know. I feel like sometimes they get harped on so much about like the negative things that it's oftentimes rewarding for them to hear about the positive things that they're doing. So that can make a difference for them as far as like positive reinforcements. And again, that good feedback.
Mm-hmm. Yeah.
Any reward or like other recognition that you, I mean, it would be up to them, right? What kind of reward they want.
Yeah, I think that would be like person to person, setting like an A1C goal even, or like if you set a small goal for the week and then get a reward, like what type of reward would they like? I don't know.
A big cake or something, dessert.
Yeah.
Probably something not food related.
Maybe a pedicure or something. New shoes.
Yeah. Like go to a movie in the middle of the day or something like that.
I'll take it. Okay, mission complete.
Cool.
Awesome.
I'm gonna stop the recordings.